In its simplest form, telemedicine is any interaction that our healthcare community has with patients at a distance. There's a common myth that telehealth is intended to replace all in-person consultations. That's really never the goal, but what we're learning is hybrid care, which is sort of a mix of video and in-person, can be a really good fit for both the providers and the patients.
One of the only pediatric endocrinologists in Western Montana, so I do a lot of traveling to see patients in outreach clinics, but we find telemedicine super helpful. All my staff also uses telemed pretty extensively. We have diabetes educators, dietitians that also see a lot of our patients by telemed.
Whether or not telehealth or video is a good fit for an appointment is ultimately up to the practitioner. They decide whether it's clinically appropriate. But evidence is supporting now that there's actually a lot more that can be done via video. And there's a lot of tools out there, many of which that we're using now, that can help the provider increase the amount and level of assessments that they can do, whether the patients are sitting at home or whether they're coming into one of our remote clinics.
The role of crisis interventionists at Logan Health is to provide mental health assessments in the emergency rooms for people who are experiencing a mental health crisis. More recently, we've added working through telehealth, the Highline. We are able to take the time, meet with patients, and figure out what the best outcomes for the patient is. And that is something that emergency room providers don't always have the time and luxury to do.
Initially, we used video in very limited ways, maybe for a last-minute cancellation or because a patient couldn't come in due to, having COVID. Now we're really shifting into a time where we want to offer care to patients in the way that they would like to be seen.
Working walk-in Polson, Montana, we have virtual care, which actually you don't have to leave your house for things that just happen to pop up, nasal congestion, cough, advice. You can call our triage nurse. They'll triage appropriately and get you the right person. Overall, it's been awesome. And some patients seem to really like the system that we have going on right now.
One of the nice things about technology is most people have the devices that they need in their pocket. Sometimes we hear that our older patients won't like video or the technology is too hard for them, and we've actually been pretty surprised. A lot of our patients have been over 65. Our oldest patient last year who used telemed was 102, and the patients in that older generation have a hard time getting to the clinic. They have a hard time transporting out of a long-term care facility or an assisted living, and so it's actually a pretty good fit for that generation. It's not just for people in rural communities. The majority of our patients are right here in the Flathead Valley, and they're using it for a lot of different reasons.
Patients with chronic pain management, they try so hard to just make ends meet, and they just enjoy it. Rather than having to come in every month physically, they can offset some of those visits by coming in virtually.
In the last year, we have offered over 20,000 video visits, saving patients over 2.5 million miles of drive time and over $500,000 in fuel.
At Neurology and Neurosurgery, we take care of patients not only from the Valley, but across the state and even across the border into Canada. This week, my team was able to coordinate a telehealth visit with a patient who lives 9 hours from here to be able to see his surgeon for that last visit prior to signing up for surgery. The patient was so grateful.
Tele isn't going to be the magic pill that solves all things healthcare, but it is an important tool that we're going to have to use our resources most efficiently and to make sure that care is not something that's so hard for folks living in big states like Montana.